Have you ever looked at your mom or your grandfather and noticed they're starting to forget the little things? Not the big, heavy moments, but the tiny details, like misplacing the same pair of glasses over and over again, or asking a question, and then 5 minutes later asking that same question again, almost like the first answer never happened. At first, you probably brushed it off. It's just normal aging. They're just tired. Maybe they've been stressed lately. Maybe you even joked about it. But deep down, a part of you keeps wondering, what if it's more than that? What if it's not just forgetfulness? What if something inside their brain is slowly changing, and no one around them is paying attention? Now here's the part most people never even consider. Sometimes these changes aren't caused by age at all. Sometimes they're triggered by the very medications that are supposed to help. Yes, medications. Everyday pills. The same ones millions of seniors take every single day without question. Pills handed over at the pharmacy. Pills doctors have prescribed for sleep, bladder control, allergies, or even anxiety. Pills that seem completely harmless. Until one day, that harmless little pill starts slowly interrupting the memory pathways inside the brain. And the most heartbreaking part, most families never make the connection. They spend months, sometimes years, thinking their loved one is just getting older. Meanwhile, the real cause is sitting right there in the medicine cabinet. That is exactly why this video is so important. Today, we're uncovering 5 common medications that have been quietly associated with increased dementia risk, and more importantly, you're going to learn how a few simple decisions can protect brain health and give your loved one the best possible chance of staying mentally sharp. So pull up a chair, take a deep breath, and really listen, because this information might change the way you look at those everyday pills forever. Backhand index pointing right comment. I'm here if you want to stay informed and make smart choices for your loved ones. And don't forget to subscribe to Longevity Corner for more true, science-based guidance on elderly care and protection. 5 key pills linked to dementia risk. Medication number 1, common sleep aids. Let's start with one of the most overlooked examples. Picture a loving husband in his late 60s. He's always been an early riser, but over the last few months, he's been struggling to fall asleep. He tosses and turns, watching the clock creep past midnight. Out of frustration, he finally walks into the pharmacy and buys one of those nighttime sleep tablets. The label says it is non-habit forming and doctor recommended. So he takes one, and it works. For the first time in weeks, he sleeps through the night. That first night becomes 2 nights, then a week, then 6 months. And slowly, little changes begin to show up. He starts forgetting the names of distant relatives. He loses track of what day it is. Sometimes, he walks into a room and can't remember what he came in for. Most people blame the usual suspect, aging. But what they don't realize is that many over-the-counter sleep aids contain anticholinergic agents that block the communication between brain cells. When used regularly, they can decrease acetylcholine, which is a key neurotransmitter for learning and memory. The longer they are used, the more disruption occurs. The big mistake families make is thinking, at least he's sleeping. Sleep is healthy. Yes, sleep is healthy, but the way you achieve it matters. A much safer approach might be to build a natural nighttime routine. Low lights after 8 p.m. Herbal tea like chamomile. Removing screens 1 hour before bed. Gentle stretching or breathing exercises. But sleep aids are not the only hidden culprit. Medication number 2, bladder control pills. Imagine an elderly woman who's always been elegant and independent. Recently, she's been experiencing urgent trips to the bathroom. She feels embarrassed and ashamed. When her doctor prescribes a quick pill to control the urgency, she gladly accepts. At first, it seems like a miracle. Fewer accidents and fewer interruptions. She starts going for walks again and even visits her friends more often. But slowly, her memory starts to slip. She begins forgetting everyday words. She tells the same story 3 times at the dinner table. Unfortunately, many bladder control medications affect the same acetylcholine receptors responsible for memory processing. So even though the bladder symptoms improve, the brain quietly pays the price. The misconception here is that the bladder issue is more dangerous than any potential side effect. Families think, we need to fix this immediately. Whatever works is fine. But that rush often leads to long-term cognitive impact. In many cases, pelvic floor exercises and simple diet changes like limiting caffeine or acidic foods can reduce those bladder symptoms naturally. Now let's talk about a drug most seniors take almost daily. Medication number 3, certain antidepressants. Imagine a widowed senior who recently lost her husband of 40 years. The grief is heavy and slowly, sadness turns into withdrawal. She stops talking and stops laughing. Her doctor, trying to help, prescribes an older antidepressant that has been around for decades. It gives her a bit of relief. But over time, her children start noticing she cannot remember full conversations. She struggles to follow simple instructions. She even forgets what day of the week it is. Some older antidepressants, particularly tricyclics, can interfere with neurotransmitter balance and increase long-term cognitive decline. The heartbreaking part is that families often assume, because this medication has been used for decades, it must be safe. But newer, low-impact alternatives exist. There's also counseling, group support, light exercise like morning walks, and meaningful activities that can help ease depression gently. This next one might surprise you because it is marketed as heart-friendly. Medication number 4, antihistamines/allergy tablets. Spring arrives and everything is blooming. But so are the allergies. A senior with a runny nose and itchy eyes reaches for an over-the-counter antihistamine. It works instantly. The sneezing stops and breathing becomes easier. Nothing seems wrong until weeks later. The same person starts having trouble focusing on simple tasks. Their energy drops and mental clarity feels foggy. Because antihistamines are seen as harmless, no one links the symptoms to the allergy tablets. Many first-generation antihistamines directly affect histamine receptors in the brain. With repeated daily use, they can reduce cognitive sharpness over time. People assume it's just allergy medicine. It can't be that bad. But switching to non-drowsy formulas or trying natural remedies, such as saline rinses and indoor air filters, can drastically reduce the need for those high-impact pills. And finally, a medication that almost every senior over 60 has taken at least once. Medication number 5, certain anxiety or calming medications. Let's say a senior starts feeling occasional anxiety, maybe from loneliness or health worries. Their doctor offers a mild benzodiazepine and says, only use it when absolutely necessary. They use it only on the bad days. Just half a pill here and another half there. It sounds harmless, doesn't it? But here is what most people never realize. Even small, occasional doses can slowly interfere with memory formation and reaction time. Over time, you may notice the person is less alert, slower to respond, and more forgetful, especially in the hours or days after taking a pill. Most families think if it reduces stress, it must be protecting the brain. But stress reduction doesn't always equal cognitive safety. Safer alternatives include breathing exercises, guided relaxation, soft music, or even structured short-term counseling with a professional trained in elderly care. So what should we do if someone we love is already taking one of these? It is scary to think a pill meant to help could actually make things worse. Nobody wants to believe that something as small as a white tablet could play a role in something as devastating as dementia. For many families, that realization hits like a punch in the chest. But here is the truth. You are not powerless. You are not helpless. The fact that you are here and listening already means you care more than most. Awareness is not just knowledge. It is protection. Once you know how these medications affect the brain, you can step in before real damage is done. So here is one simple thing you can do right now. Take 5 minutes and look at the list of medications your loved one is currently taking. Read the labels. Ask the doctor questions. Do not be afraid to say, is there a safer option, or could this be affecting their memory? You may be surprised how many physicians will say, yes, we can try something else. The goal is not to remove every single medication. It is to make small adjustments that protect the most precious thing we have left, their mind. It is not too late. Even small steps can make a big difference. With a little patience, with gentle attention, with a willingness to ask questions and stay involved, these years can still be filled with clarity, with laughter, with warm afternoons sitting together and talking about old memories, not just remembering them, but reliving them. That is what our loved ones deserve. A mind that stays connected, a heart that stays engaged, and a family that refuses to turn a blind eye. Before we wrap up, let's take a quick moment to recap what we covered today, because even one of these medications can make a meaningful difference in someone's long-term brain health. Today, we talked about 5 common medications that are quietly linked to memory loss and higher dementia risk over time. First, sleep aids that contain strong anticholinergic compounds. Second, bladder control pills that reduce physical symptoms but interfere with neurotransmitters. Third, older antidepressants, especially tricyclics, which can disrupt long-term cognitive function. Fourth, first-generation antihistamines that many seniors take for allergies without knowing their mental effects. And finally, certain anxiety or calming medications, which may seem harmless but slowly chip away at clarity and reaction time. These medications are often prescribed with good intentions, but even so, they deserve a second look. Backhand index pointing right, which one of these surprised you the most? Backhand index pointing right, have you noticed anyone in your family taking one of them without knowing the risks? Let me know in the comments. I read every single one, and your story might help another family become more aware. If you found this video helpful, or if you want to keep learning practical, science-based tips to protect the minds and dignity of the people you love, go ahead and hit the subscribe button and join the Longevity Corner community. We post new elderly care and brain health guidance every single week, and it might be exactly what someone in your family needs. Thank you so much for spending this time with me today. Stay kind, stay informed, and always remember, small steps taken today can protect a lifetime of memories tomorrow. I will see you in the next one.